So you go to your doctor and you're like, Doc, hey, this BV keeps coming back. I keep getting treated with flagyl. You switch to clindamycin. I'm trying the boric acid suppository, but it keeps coming back. What do I do now? Your doctor says, hey, it's time for us to get medicine for your partner too. And your first response is, wait a minute, doc, you told me that BV wasn't a sexually transmitted disease. It's not a sexually transmitted disease. It's not an STD. It's a STI, a sexually transmitted infection. Let's pretend this is a bowl of bacteria and I touched it. The powder is now there and I've now infected myself with it. But you know what? My finger's intact. There's nothing wrong with it and nothing will be wrong with it. I just have extra bacteria there. That is an infection. But look at it now. That touching that bacteria had the potential to change my finger. It's now blue, it's altered, can be problematic. That is a sexually transmitted disease. Let's go back to our balanced vagina. Same amount of bacteria, same amount of yeast. The vagina is constantly trying to maintain this state right here. But you're intimate with your partner. Do a little loving and cuddling, and then you pass along a little bacteria to him. Now you have much more yeast than you do bacteria. Vagina doesn't like that. So it makes a move to start growing more bacteria so that what? The vagina can get back in balance again. So the vagina has done what it needed to do to get back in balance. It's quite happy now. But your partner never got rid of the bacteria that you gave him the last time that you were intimate. So you're intimate again, and what does he do? He gives you your bacteria right back at you. And now you're out of balance. So this is why many times we are now directed to not only treat you, but to treat your partner too. But for your partners, we do things a little different. Usually we recommend that he takes the pill and the cream. What we'll have him do is take the pill for 7 days, twice a day, and we'll ask him to place the cream along the penis for 7 nights. We ask that you both do us a favor and avoid intercourse during that treatment period. We want to get those bacterial levels nice and down to a normal range. And then sometimes you've tried all the things. You tried the flagyl, the clindamycin, the boric acid, you had your partner treated, and you continue to get this watery discharge with a funny odor. Then there's something else I want you to consider maybe going on as well. Ask your doctor if you've been tested for mycoplasma or ureaplasm. I know it's a mouthful to say, but these are what we call atypical bacteria. Their cell walls look a little different than your normal bacteria. That makes a big difference because their cell wall is different. They are not going to respond to flagyl or clindamycin. So you could be taking these antibiotics over and over and over again, but the culprit could be something that's not sensitive to the antibiotics that we're calling in for you. Mycoplasma and ureaplasm are typically only sensitive to azithromycin or doxycycline. Infection with either of those require partner treatment too, unless you want to deal with this over and over. Stay tuned for the final part of this series when we talk about things that you can do at home to decrease your risk of BV coming back again and again.